Hello and welcome to Seven Sentinels. This is Grandmaster class and I'm Peter Simon with you. Today we are conducting speaking sessions and we have a nurse with us and her name is Praneetha Pamarthi and this is a speaking role play session. Yes, Praneetha, you can just go through this card. You have already prepared, I know, I have given you time, but this is just for the viewers on the YouTube. So that's fine. Yes. Yes. You can start now.
Good evening, sir.
Yes, good evening.
Please be seated.
Thank you very much, nurse.
I am one of the registered nurses working in this hospital ward. So, how are you feeling now?
I am fine, nurse.
Okay. I know you came for hair stitches removal. Is it right?
Yes, of course, nurse.
Okay. How was your condition now?
I am fine. Everything is going on well, but the doctor told me that I have to discuss something with you, and I was called for that one. And you know, the doctor told me that I had squamous cell carcinoma, and I think that is just another name for skin cancer. I'm a little bit worried, nurse. Can you please help me?
Yes, of course. Your concerns are reasonable. I would like to ask a few more questions. You don't know squamous cell carcinoma before? You know
I
any
don't
idea?
know anything about this squamous cell carcinoma. I'm hearing it for the first time. I just thought that it is something called skin cancer. Is that right, or is there anything else?
Yes, you are absolutely right. Squamous cell carcinoma is a not life-threatening condition. It is one type of skin cancer, and it will occur squamous cell carcinoma middle and outer layers of the skin. So when we are exposed in the sun, mostly in ultraviolet rays, it will come. So can you take any precautions if you go to in sunrise, in sunset? You take precautions. It is better for you, and occasionally you apply with medicines. It is also curable. And are you having any doubts regarding that?
Yeah, what you said, I understand a little bit now. I have better understanding of what squamous cell carcinoma is now. I want to ask you if I am likely to need more surgery to remove other lesions in the future.
Yes, yes. Your questions are completely good, and I will explain you. Uh, Actually, squamous cell carcinoma is not a life-threatening. It is very common causes. So don't be aggressive. If we are not treated, means it can be aggressive, but it can be treatable for many surgical options, and there are many treatment options are available there. So we can remove surgery on the lesions. So nothing to be worried about that. Surgery is more helpful, and it is unlikely to spread. And depending upon size, location, and aggressiveness, as well, preferences we will see how much preference is there. So it's depending upon condition. Okay, so don't be worried about that.
Okay, nurse, I understand. Fine. Actually, whenever I go out, I'm always wearing a high factor sunscreen. And then 30 or higher, the number. I wear a hat when I'm out in the sun. But I think it's already too late because the damage has already been done. And yeah, in my teenage years, I spent much time in the sun. That's possibly triggered this problem.
Yes, I understand. I understand. So there is nothing to be alarmed about necessary, and your condition is normal. And what you are following is it is very good, and you can follow like this only. When you are going out, you can cover your skin with the hat and applied some sunscreen lotions. It is very beneficial for your skin, and as well as reduce your cancerous cells also, reduce your skin cancer types, not like that, reduce your infection rate also. So can you follow like these precautions? Means it is very helpful.
Yeah, nurse, I'll definitely follow your suggestions. I'll make sure to look after my skin from now on.
Yeah, it would be very beneficial. And what about your post surgery? How was your wound? How does your wound, and it is any pain or discharges?
No, nurse, the wound has been fine and there is no pain and there is no discharge, but I still think it's too early to remove the stitches. Can't I wait for some more time, nurse?
I will explain you. Actually, sutures removal procedure is it will be taking 7 to 14 days after we can remove the sutures. It is the good time to remove the sutures, and the doctor will prescribe and doctor will suggest and he assess and he will advise to remove the stitches. So you don't be worried. He can assess and he will follow up the procedure, and we can do. After that, you can maintain some proper hygienic techniques. When your wound is clean and when you are going out, just you keep it your wound cover and dry. It is help to reduce infection rate. So you can prevent infection also. It is good for your wound, and a speedy recovery also we can observe. It helpful.
Yes, nurse. I understand what you're telling and really I appreciate your concern. I am ready for the stitches to be
Yes.
removed. I give my
Thank,
consent.
okay, thank you. Do you have any doubts regarding that?
No, nurse, I'm clear. Everything is explained well. Thank you very much, nurse.
Thank you for your visiting, and I wish you a speedy recovery. Thank you.
Thank you, nurse. Thank you once again. Yeah. So that's the end of the session. We had a session with Praneetha Pamarthi, and she's a nurse by profession. And we have seen the first part, that is the role play as it is. No feedback given now. Now then our artificial intelligence is there, Simon's autopilot is already typing our sentences, our dialogues. And after that, I'll take it in the PDF form and I'll be sending you. Then you can come for the second round, that is a feedback round. I will discuss word after word and sentence after sentence what mistakes you are doing and everything. So that's the end of the session for today. And those who are watching this video on the YouTube, you can just get back to me if you're really interested and for particular personal sessions, individual sessions. Then what you can do is you can subscribe to the speaking course, or if you want writing also, or reading and listening, whatever course you want, you can register there and you can get back to me. And my number is +91 9877 67360. I repeat, 9877 67360. You can add a +91 in the beginning. That's the country code, India's country code. Thank you very much.